What if I told you that drinking one simple beverage before bed could help your lungs clear mucus, reduce inflammation, and repair damage while you sleep, turning those vulnerable 8 hours into a time of healing instead of decline? Right now, millions of seniors are going to bed every night drinking things that actually harm their respiratory health, triggering mucus production, increasing inflammation, and making morning breathing worse. Meanwhile, for specific beverages that most people have never considered are being used by respiratory health experts to transform lung function overnight, helping people wake up breathing clearly for the first time in years. This isn't about exotic superfoods or expensive supplements. These are simple drinks you can make in 5 minutes with ingredients readily available at any grocery store. The shocking truth is that what you drink in the 2 hours before bed has a massive impact on how your lungs function during sleep and how you feel when you wake up. Most people reach for water, milk, or even alcohol before bed without realizing these choices directly affect whether their lungs will struggle or thrive during the night. But the 4 beverages I'm about to reveal work specifically to support respiratory health overnight, thinning mucus, opening airways, reducing inflammation, and providing nutrients your lungs need for repair. In the next few minutes, I'm going to reveal these 4 powerful nighttime drinks, explain exactly how each one helps your lungs while you sleep, show you how to prepare them properly for maximum benefit, and share the remarkable transformations that thousands of seniors have experienced simply by changing what they drink before bed. Your lung health could transform starting tonight with one simple beverage choice, and the benefits will compound night after night as your lungs finally get the overnight support they desperately need. If you're a senior dealing with respiratory issues, you know that mornings are usually your worst time. You wake up congested with thick mucus that's hard to clear. Your chest feels tight. You might cough for an hour before you can breathe comfortably. You've probably tried various approaches to improve your morning breathing, but you may never have considered that what you drink before bed could be a major factor in how your lungs function overnight and how you feel when you wake up. Here's what most people don't understand about nighttime beverages and lung health. Your body continues producing mucus during sleep, and the consistency of that mucus is directly affected by what you consume before bed. If you're dehydrated or have consumed things that trigger mucus production, you'll wake up with thick, sticky mucus that's nearly impossible to clear. Your airways can become inflamed overnight based on what inflammatory or anti-inflammatory compounds are in your system. Your body does most of its tissue repair during sleep, and whether your lungs can repair effectively depends on having the right nutrients available during those nighttime hours. Most seniors make terrible choices about nighttime beverages without realizing the impact. Some drink nothing, going to bed dehydrated, which makes morning mucus thick and difficult to clear. Others drink milk or dairy-based beverages before bed, which for many people increases mucus production overnight. Some have alcohol in the evening, which dehydrates tissues and can worsen sleep apnea and breathing problems. Others drink caffeinated beverages too close to bedtime, which disrupts sleep quality and keeps airways more constricted. All of these common choices work against lung health overnight. But thousands of seniors who discovered these 4 specific nighttime beverages have experienced remarkable improvements. They wake up with less congestion, easier mucus clearance, reduced coughing, and noticeably better breathing. Their lung function tests show improvement. Their resistance to respiratory infections increases. Their sleep quality improves because they're breathing better throughout the night. All from making one simple change to what they drink in the hour or 2 before bed. Let me explain what's happening to your lungs during sleep and why these specific beverages are so powerfully supportive. During the 8 hours you're sleeping, your lungs face several challenges. Mucus production continues, but the natural clearance mechanisms slow down dramatically. You're not coughing, not moving around much, not drinking water to stay hydrated. Any mucus being produced tends to accumulate and thicken in your airways. Your body goes into repair mode during sleep, working to heal inflammation and damage from the day. But this repair process requires specific nutrients and compounds to be available in your bloodstream. If those nutrients aren't there, the repair doesn't happen efficiently. Your airways may be dealing with inflammation from environmental exposures, allergens, or chronic conditions, and whether that inflammation gets better or worse overnight depends partly on what anti-inflammatory compounds are circulating in your system. Hydration status during sleep affects everything from mucus consistency to blood oxygen levels. When you're even mildly dehydrated, mucus becomes thick and sticky, airways can narrow more easily, and your body has to work harder to maintain adequate oxygenation. For seniors, who often already have reduced lung capacity, these factors can make the difference between waking up breathing comfortably or waking up in distress. The consequences of making poor beverage choices before bed accumulate over time. Night after night of thick, sticky mucus leads to chronic congestion and increased infection risk. Night after night without proper nutrients for repair means lung damage from the day never fully heals. Night after night of dehydration or inflammation-promoting beverages accelerates respiratory decline. Morning symptoms that you think are inevitable are actually the result of what you are or aren't drinking before bed. Now let me reveal the 4 nighttime drinks that can transform your lung health and exactly how each one works. Nighttime drink number 1 is warm water with honey and lemon, consumed about 30 to 45 minutes before bed. This simple combination is remarkably powerful for lung health overnight. The warm water provides essential hydration that keeps mucus thin and easy to clear. The honey has natural antimicrobial properties that help prevent respiratory infections, and it coats and soothes irritated airways. Honey also has compounds that reduce coughing and help you sleep better. The lemon provides vitamin C and antioxidants that support immune function and reduce inflammation. To prepare this drink properly, heat 8 to 10 ounces of water until it's warm but not boiling. Squeeze the juice of half a fresh lemon into the water. Add 1 to 2 tablespoons of raw honey and stir until dissolved. Drink this slowly in the hour before bed. The warmth soothes your throat and airways. The hydration prepares your body for the long night ahead. The honey and lemon work together to reduce inflammation and support your respiratory system throughout your sleep. Many people who make this their nightly drink report that they wake up with dramatically less morning congestion and can clear their lungs much more easily. Nighttime drink number 2 is ginger turmeric tea, consumed 1 to 2 hours before bed. This powerful combination provides potent anti-inflammatory effects that work overnight to heal your airways. Ginger contains compounds called gingerols that reduce inflammation throughout the respiratory system, help thin mucus, and have antimicrobial properties. Turmeric contains curcumin, one of the most powerful natural anti-inflammatory compounds known, which specifically reduces airway inflammation and helps protect lung tissue from damage. Together, these create a healing effect in your lungs that continues working while you sleep. To prepare this tea, boil water and add 1 inch of fresh ginger root, sliced or grated, and 1 teaspoon of turmeric powder or 1 inch of fresh turmeric root, grated. Let it simmer for 10 minutes. Strain into a cup and add a pinch of black pepper, which increases curcumin absorption by up to 2000%, and honey to taste. The black pepper is crucial because without it, you don't absorb much of the turmeric's beneficial compounds. Drink this tea warm about an hour or 2 before bed. You want to give it time to work through your system before you lie down. People who drink this tea regularly report reduced nighttime coughing, easier breathing during sleep, and less morning chest tightness. Nighttime drink number 3 is warm almond milk with cinnamon and a touch of honey, consumed about an hour before bed. This combination provides several lung benefits. Almond milk is naturally anti-inflammatory and doesn't trigger mucus production the way dairy milk does for many people. It provides vitamin E, which is a powerful antioxidant that protects lung tissues. Cinnamon has antimicrobial and anti-inflammatory properties and helps regulate blood sugar, which is important because blood sugar spikes can increase inflammation. The honey again provides soothing and antimicrobial effects. To prepare this drink, warm 8 ounces of unsweetened almond milk in a small pot. Don't boil it, just warm it to a comfortable drinking temperature. Add half a teaspoon of cinnamon powder and 1 tablespoon of honey. Whisk until well combined and slightly frothy. This drink is particularly good for people who enjoy having something creamy before bed but have found that dairy milk makes their morning congestion worse. The warm, slightly sweet drink is soothing and satisfying, and the nutrients support lung health overnight. Many people who switch from dairy milk to this almond milk mixture report that their morning mucus production decreases dramatically within just a few days. Nighttime drink number 4 is licorice root and marshmallow root herbal tea, consumed 1 to 2 hours before bed. This combination is specifically used in traditional medicine for respiratory health and is remarkably effective. Licorice root contains compounds that reduce inflammation, support immune function, and help soothe irritated airways. It also has mild antimicrobial effects. Marshmallow root contains mucilage, a substance that coats and soothes irritated mucous membranes throughout your respiratory system. Together, these herbs create a protective, healing effect in your airways that lasts throughout the night. To prepare this tea, use commercial tea bags that contain both herbs, or if using loose herbs, add 1 teaspoon of dried licorice root and 1 teaspoon of dried marshmallow root to boiling water. Let it steep for 10 to 15 minutes, covered, to extract the beneficial compounds. Strain and drink warm. You can add honey if you like, but the licorice root already has natural sweetness. This tea is particularly beneficial for people with chronic dry cough or irritated airways. The coating effect of the marshmallow root provides lasting relief, and people who drink this regularly often report they can sleep through the night without coughing, something many hadn't experienced in years. Let me tell you about Frank, a 73-year-old man who had been waking up every morning for 5 years feeling like his chest was full of cement. He would cough violently for the first hour of every day, bringing up thick, sticky mucus. His mornings were miserable. He'd tried various medications with limited success. His doctor suggested he might have chronic bronchitis and would need to manage it long-term with medications. Then Frank attended a wellness seminar where a naturopath mentioned that nighttime beverage choices could affect morning respiratory symptoms. Frank had been drinking a glass of milk every night before bed, thinking it was healthy. He decided to experiment by replacing his nightly milk with the warm honey lemon water. The very first morning after making this change, Frank noticed his mucus was thinner and easier to clear. By the end of the first week, his morning coughing had decreased by about 40%. Encouraged by these results, Frank started rotating through all 4 drinks, having a different one each night. Within a month, his morning symptoms had improved by what he estimated was 75%. He was waking up breathing more clearly than he had in years. His wife said he wasn't coughing during the night anymore, which meant they were both sleeping better. When Frank told his doctor about the improvement, the doctor was surprised but supportive, saying that if simple dietary changes were helping, Frank should definitely continue them. Frank now makes these nighttime drinks a non-negotiable part of his routine. He says that spending 5 minutes preparing a healing beverage before bed has transformed his quality of life more than any medication ever did. He rotates through all 4 drinks depending on how he's feeling, using the ginger turmeric when he feels inflammation is high, the licorice marshmallow when his throat feels irritated, the almond milk when he wants something comforting, and the honey lemon most other nights as his baseline support. The key to success with these nighttime drinks is consistency and proper preparation. Choose one to start with, whichever appeals to you most or addresses your specific symptoms best. Prepare it fresh each night as part of your bedtime routine. Drink it slowly, mindfully, letting the warmth soothe your throat and airways. Give it time to work through your system before lying down, so drink it at least 30 to 60 minutes before actually getting into bed. Pay attention to how you feel the next morning compared to how you usually feel. Most people notice some improvement within just a few nights, with significant changes by the end of 2 weeks of consistent use. You can stick with one drink every night, or you can rotate through different ones depending on your needs. Some people use the anti-inflammatory ginger turmeric during weeks when allergies or pollution are high. Others use the soothing licorice marshmallow when they have a cough. The honey lemon water works well as an everyday baseline drink that anyone can benefit from. It's also important to note what not to drink before bed. Avoid dairy milk if you notice it increases mucus production, which it does for many people. Avoid alcohol, which dehydrates tissues and can worsen breathing problems during sleep. Avoid caffeine after mid-afternoon, as it can interfere with sleep quality and keep airways more constricted. Avoid sugary beverages that spike blood sugar and promote inflammation. The goal is to give your lungs the support they need overnight, and that means choosing beverages wisely. Naturopathic doctors and integrative medicine practitioners have long recommended nighttime beverages as part of respiratory health protocols, though mainstream medicine rarely addresses this factor. Research on honey has documented its effectiveness for reducing cough and improving sleep quality in people with respiratory issues. Studies on ginger and turmeric consistently show powerful anti-inflammatory effects that specifically benefit respiratory tissues. The scientific literature on herbal teas like licorice and marshmallow root documents their traditional use for respiratory conditions and validates many of their protective effects. Respiratory therapists who take a holistic approach to lung health often recommend proper hydration and anti-inflammatory beverages as part of comprehensive care plans. They report that patients who implement these nighttime beverage strategies alongside other interventions have better outcomes, fewer exacerbations, and improved quality of life. Sleep medicine specialists recognize that nighttime hydration affects sleep quality and breathing during sleep, though they often focus on how much to drink rather than what to drink. The insider knowledge that integrative health practitioners share is that simple dietary interventions like nighttime beverages can provide benefits comparable to some medications without any side effects. These drinks work by supporting the body's natural healing processes rather than suppressing symptoms, which leads to genuine improvement rather than just symptom management. Here's something that will change how you think about beverages and lung health. Research on traditional medicine systems around the world, from Ayurveda to traditional Chinese medicine to European herbalism, shows that cultures with the best respiratory health into old age all have traditional nighttime beverages that contain similar compounds: honey, warming spices, mucilage containing herbs, and anti-inflammatory roots. Modern science is now validating what traditional wisdom knew, that what you drink before sleep directly affects respiratory health overnight. The revelation that surprises many people is how quickly these simple beverages can produce noticeable changes. Unlike medications that might take weeks to show effects, most people notice improved morning breathing within just a few days of starting one of these nighttime drinks. This happens because you're addressing the immediate factors that cause morning symptoms: hydration, mucus consistency, and overnight inflammation, rather than trying to treat underlying disease processes that take longer to change. When you start drinking one of these healing beverages each night and experience the improvement in your morning breathing, the psychological benefits are significant. The act of preparing a healing drink for yourself feels nurturing and empowering. You're taking concrete action to support your health in a way that's simple and pleasant rather than difficult or unpleasant. The ritual of having this special drink each night becomes something you look forward to rather than another chore or medical intervention you have to endure. People who successfully incorporate these nighttime drinks describe feeling more in control of their health. They're not just passively taking medications prescribed by doctors. They're actively doing something that makes a noticeable difference. The confidence that comes from waking up breathing more easily reduces anxiety about respiratory decline and improves overall quality of life. Sleep quality often improves not just because breathing is better but because you feel calmer knowing you've done something positive for your lungs. We've covered the 4 nighttime drinks that can transform your lung health while you sleep. Warm honey lemon water for hydration, soothing, and antimicrobial effects. Ginger turmeric tea for powerful anti-inflammatory action. Warm almond milk with cinnamon and honey for non-dairy nourishment and inflammation reduction. Licorice marshmallow root tea for airway coating and healing. Each of these beverages provides specific benefits that support your lungs during the vulnerable overnight hours when natural clearance mechanisms slow down and repair processes need nutritional support. The question isn't whether these drinks work. Traditional use spanning centuries and modern research both confirm their benefits. The question is whether you're going to try one tonight and give your lungs the overnight support they desperately need, or whether you're going to continue waking up with thick mucus, congestion, and difficult breathing morning after morning. Here's what you need to do today. Choose one of these 4 drinks that appeals to you or addresses your specific symptoms. Get the simple ingredients you need, all readily available at any grocery store. Tonight, prepare the drink and consume it 30 to 60 minutes before bed. Notice how you feel tomorrow morning compared to how you usually feel. Commit to having one of these healing drinks every night for 2 weeks and pay attention to how your morning breathing changes. Your lungs are working all night long with minimal support, facing challenges of mucus accumulation, inflammation, and dehydration. These 4 beverages provide the hydration, anti-inflammatory compounds, soothing effects, and nutrients your lungs need to thrive overnight instead of merely surviving. 5 minutes preparing a healing drink tonight could transform how you wake up tomorrow. Consistent nightly practice could transform your respiratory health for the rest of your life. Make the choice now to support your lungs overnight. Your morning breathing, your sleep quality, your energy, all depend on this simple beverage decision. Start tonight. Your lungs are waiting for the support only you can provide.